Hello, everyone! Today's topic is sure to send shivers down many spines. The US healthcare market in 2026 has completely blown up. Premiums are skyrocketing faster than rockets, deductibles are shockingly high, and more Americans simply can't afford it. They're forced to abandon their health coverage. Plunging into the nightmare of getting sick means going broke, can you believe it? In this nation touted as the world's wealthiest, ordinary people are forced to choose between saving their lives and saving their wallets. What's really going on? Today, we'll dive deep into the analysis and see just how broken the US healthcare system truly is. In truth, the seeds of this healthcare crisis were sown long ago. On December 31, 2025, the enhanced subsidies under Obamacare officially expired. Introduced during the 2021 pandemic as a relief measure, these subsidies eased premium burdens for millions. But with Congress deadlocked over extending them, over 20 million Americans now face premium nightmares, average hikes soaring to 114%. This is no small matter. Regional increases are downright staggering. In Oklahoma, a single mother working freelance previously paid $650 monthly for health insurance covering her and her son. By 2026, she discovered her premium had skyrocketed to $1,151, nearly doubling. The deductible surged even more dramatically, jumping from $15 to $4,000, rendering the plan unaffordable. Moreover, the state's largest insurer, Blue Cross Blue Shield, reported premium hikes for individual Obamacare plans ranging from a minimum of 14.2% to a staggering 56.2% in 2026. HMO plans saw an average increase of 37.61%, while PPO plans rose by 32.78%. This isn't just a price hike, it's outright robbery. Florida faces equally dire circumstances. The 45-year-old Bongs run a small video production studio as freelancers. One spouse has an eye condition requiring regular specialist care and potential future surgery. Their 2026 premium notice showed monthly costs exceeding $1,100 more than 4 times their previous subsidized payment. The Bongs were devastated, describing the situation as disgusting and helpless, with no clear solution in sight. It's not just freelancers. Employer-sponsored health plans are also affected. One teacher noted her employer's lowest-tier plan originally cost $630 monthly, but the school district raised it by $300 to $935. This is a high-deductible plan with steep coinsurance, meaning she shares costs even without claims. This amount nearly consumes 1/5 of her salary, and she's reaching her limit. The Smiths, a landscaping business owners in Idaho, must maintain their current health plan in 2026 at a monthly premium of $1,000 a dollar. $290 increase primarily due to losing their $130 monthly federal subsidy. This further strains their already tight household budget. The hardest hit are retirees. Take Clint, 63, and Cindy, 64, a couple in Oregon. Clint has muscular dystrophy, while Cindy requires regular injections to walk. Healthcare is essential for them. Before subsidies, their monthly Obamacare premium was just $305. However, in 2026, their agent informed them that to maintain the same plan, their monthly premium would skyrocket to $2,500. The reason? Their combined pension and Social Security income exceeded the threshold for enhanced subsidies, disqualifying them from federal assistance. The couple was stunned, now forced to consider postponing surgeries or even relocating overseas for cheaper medical care. It's truly heartbreaking. Nationally, the situation isn't much better. In 2026, premiums for the benchmark plan, the second lowest cost Silver plan, rose by an average of 26%. States using healthcare.gov saw an average increase of 30%, while state-run independent marketplaces saw a 17% rise. This benchmark plan is crucial as it serves as the reference for calculating federal subsidies. Its increase directly burdens tens of millions of enrollees. The pressure varies significantly across income groups. For a 40-year-old with an annual income of $31,000, monthly premiums jumped from $58 to $153, a 165% increase. A 60-year-old earning $64,000 saw their annual premiums rise from $5,440 after subsidies to approximately $14,900, exceeding 23% of their income. This truly crushes people. What's worse is the reemergence of the subsidy cliff. If an individual's annual income exceeds $63,000 to 400% of the federal poverty line, they lose all subsidies and must pay full premiums, even if their income is just $1 higher. Many middle-income families are thus excluded, which is utterly unreasonable. In high-cost areas, premiums are even more staggering. In Texas, where the cost of living is moderate, the monthly premium for a bronze demo plan is $430, yet the deductible soars to a staggering $9,000. In the Baltimore metropolitan area of Maryland, a 40-year-old purchasing the lowest tier bronze demo plan faces a monthly premium of $328 to $339. For a family of 4, the monthly premium exceeds $1,100. In major cities like Boston and New York, premiums are so high they're prohibitive. What does this mean? You pay $430 monthly for insurance, but when you actually need it, you must first pay over $9,000 out of pocket before receiving benefits. How is that any different from having no insurance at all? It's essentially throwing money away. Today, healthcare costs for many American families exceed mortgage and car loan payments. A October 2025 survey by the Kaiser Family Foundation revealed that the average employer-sponsored health insurance premium for a family of 4 reached $26,993 in 2025, projected to rise another 9% in 2026 to nearly $29,422. Some citizens reported their monthly premiums jumping from $292 to $458 nearly, matching their car loan payments. Others report paying $550 monthly for individual health insurance, nearly $8,000 annually, at receiving coverage only for the most basic medical services, making it a poor value. The Urban Institute and the Federal Fund jointly predict that approximately 4.8 million Americans will completely forego health insurance in 2026. Increasingly, families are forced to choose between paying premiums and maintaining basic living expenses, a truly harsh reality. Beyond rising premiums, the real outrage is that many insurance plans offer little actual coverage. Extensive basic health care needs are excluded from protection, with numerous plans omitting dental and vision coverage. Even core medical benefits face significant issues. One teacher revealed that her employer-sponsored plan refuses to cover her daughter's thyroid medication. Despite FDA approval, insurance companies plan to discontinue reimbursement for GLP-1 drugs starting January 2026. This medication is precisely what her daughter needs for treatment. Isn't this tantamount to endangering lives? This situation is far from isolated. A Kaiser Family Foundation survey reveals that while most employers will still cover GLP-1 drugs in 2025, over half plan to reduce coverage for these high-cost medications and tighten eligibility requirements by 2026 due to cost pressures. This means many patients requiring these drugs will lose coverage. Utterly outrageous. Even more unacceptable is the phenomenon where insurance reimbursement costs more than paying cash. One mother took her daughter for an MRI to treat a sports injury to her knee. She first inquired about the insurance-covered price only to discover it was higher than paying out of pocket. She later learned that many medical institutions have confidentiality agreements with insurance companies, meaning they won't proactively inform patients that cash payment is cheaper. Only if patients ask will they disclose it. She specifically compared quotes from 2 facilities. One quoted the insurance price, the other the cash price. The difference was so staggering it made her tremble with anger. This is outright extortion. The claims process is equally disastrous. Not only did they pass the buck, but they also shifted blame, leaving the insured person utterly miserable. One individual studying medical billing and coding underwent a hysterectomy in April 2026. She had 2 insurance policies: Cigna insurance provided by her employer as the primary plan, and the government-subsidized Better So plan as the secondary plan. By regulation, employer insurance always takes precedence over government-subsidized plans. But Cigna didn't contact her to coordinate benefits until June. By August, her oncology clinic called saying Cigna demanded reimbursement, claiming Better So was the primary plan because it had a longer enrollment period. She waited an hour to reach Cigna, only to be transferred to their subsidiary, Coventry. Coventry then stated her coverage had a 1-month gap last May, so enrollment duration was the deciding factor. She explained she had only left her job for 1 month before returning. Even if the gap had been longer, switching to a new job using Cigna coverage should have made Cigna the primary insurer. That's the policy. Yet from her April surgery to August, 5 months had passed with the issue still unresolved. It was truly maddening. Claim denial rates vary significantly between insurers, further exacerbating the chaos. United Healthcare's claim denial rate soared to 32%, double the industry average of 16%. In contrast, Kaiser Permanente, operating as an integrated HMO combining payer and provider functions, maintained a denial rate of just 7%, far below the industry average. This reveals how many insurers deliberately tighten claim reviews for profit, arbitrarily rejecting medical necessity and denying policyholders legitimate claims. A patient with kidney failure had her authorization denied by Aetna Insurance before hospitalization, citing non-compliance with coverage requirements. However, the hospital explicitly stated the patient required inpatient observation, leaving her with no alternative. She attempted to coordinate with the physician responsible for peer review but discovered the team consisted of rotating residents not full-time, staff making contact impossible. Nurses could only make decisions based on existing information, leaving the patient stranded and utterly helpless. Resolving claims disputes proves equally arduous, demanding extensive time and effort to negotiate repeatedly with insurers, sometimes necessitating legal action. Ordinary citizens often find themselves at a disadvantage when confronting complex policy terms and cumbersome procedures. Many, after prolonged efforts yielding no resolution, ultimately abandon the fight and shoulder exorbitant medical costs themselves. This claims system not only increases the financial burden on policyholders but also erodes public trust in health insurance, with growing numbers concluding that buying insurance is pointless. In this healthcare crisis, several groups face particular misfortune, plunging directly into an uninsured crisis with increasingly dire living conditions. First are single mothers. Many are freelancers or part-time workers without employer-sponsored insurance or a spouse to share the burden. They also bear the responsibility of raising children, already facing significant financial pressure. One Oklahoma single mother, after facing doubled premiums and skyrocketing deductibles, could no longer afford coverage and ultimately lost her health care. Another widowed single mother, a teacher, had to work 3 jobs just to pay for insurance. Even then, premiums kept rising, and her daughter's essential medications weren't covered. It's truly a struggle. Next are the self-employed. According to 2022 data from the U.S. Bureau of Labor Statistics, flexible workers have significantly lower health insurance coverage rates than full-time employees. For low-income freelancers, coverage falls below 40%. When Obamacare subsidies expire in 2026, they will face an even greater shock. Many previously relied solely on government subsidies to cover premiums. Once these subsidies are withdrawn, premiums will double or even skyrocket. The Bongs in Florida are one such case. Their premiums tripled to over $1,100 monthly. They have eye conditions requiring treatment but cannot afford it, leaving them utterly helpless. The unemployed and middle-aged, elderly groups also face immense hardship. A 60-year-old man took leave to care for his parents and became unemployed. His Obamacare premiums were $472 monthly, which he could no longer afford after losing his job, forcing him to abandon his coverage. For seniors, the burden is even heavier. Clint, 63, and Cindy, 64, saw their premiums jump from $305 to $2,500. After losing subsidies and failing to qualify for assistance, they have chronic conditions requiring long-term treatment but must postpone surgeries, even considering moving overseas, which is truly heartbreaking. Another 57-year-old resident, unable to afford the steeply increased premiums, settled for critical illness insurance instead. losing basic healthcare coverage and now praying they never get sick. To keep their insurance, many families are forced to make extreme choices. One woman with a master's degree now works 20 hours a week at Starbucks just to qualify for healthcare benefits. Giving up a professional job matching her education, a truly unfortunate situation. Some families, overwhelmed by premiums, have opted for zero coverage, choosing not to enroll in any health plan in 2026 and relying solely on out-of-pocket payments for medical needs. Data from California's California Universal Coverage program shows that enrollment in 2026 rose only marginally by 1.1% to 1.9 million people, while average premiums surged by 35%. Among them, premiums for 120,000 individuals earning between 400% and 600% of the federal poverty level surged by 85%. Only 300,000 low-income enrollees saw net premium reductions due to state subsidies. The Urban Institute predicts 4.8 million Americans will abandon health coverage by 2026. This group's lack of health protection not only compromises their well-being but also fuels social instability, highlighting the unfairness and irrationality of the U.S. healthcare system. Faced with such a flawed healthcare system, a growing number of Americans are opting out of traditional insurance, sparking a wave of policy cancellations. Simultaneously, alternative healthcare solutions have emerged as a necessary response to the crisis. Among these, direct primary care (DPC) clinics are gaining popularity. This model bypasses insurance companies, allowing patients to pay a fixed monthly fee to the clinic for comprehensive primary care services. One family of 7 shared their experience. For just $265 monthly, they gained access to 24/7 text consultations, phone appointments, all visit fees covered, telemedicine, annual physicals, and basic screenings. Compared to spending thousands monthly on traditional insurance, this saved them substantial costs. Moreover, because the fees were affordable, they utilized more healthcare services in 2026 than in previous years, truly achieving no worries about minor illnesses. It really is quite good. Latest data shows 2,060 DPC clinics currently operate across 48 states and Washington, D.C., primarily in urban and suburban areas, with some serving low-income communities. However, specialty DPCs such as cardiology and dermatology remain concentrated in middle to high-income regions, indicating uneven distribution. Although DPC clinics are still relatively scarce, growing attention is being paid to this model amid intensifying insurance dropouts, positioning it as a viable alternative to traditional health insurance. Beyond DPC, health mutual aid plans are also gaining traction. Many who watch the insurance dropout videos are seriously considering joining mutual aid plans, redirecting their premium payments toward shared resources to cover unexpected medical needs. While this approach carries risks, many view it as a viable alternative to paying high premiums for inadequate coverage. Regarding healthcare cost control, many have adopted the strategy of comparing prices across multiple providers. Under U.S. law, all hospitals must publish transparent pricing on their websites and provide cost estimation tools. Out-of-pocket patients often secure significant discounts. Since the 2026 healthcare crisis, more individuals are proactively leveraging this policy. Before undergoing medical procedures, patients check costs across multiple hospital websites and choose the most affordable option, especially in major cities where healthcare pricing is highly competitive. This comparison can save thousands of dollars. For instance, one resident proactively asked for the cash price when inquiring about an MRI for her daughter and discovered it was cheaper than insurance coverage, successfully avoiding being overcharged. When facing unexpected major medical expenses, some individuals utilize specialized medical credit tools like the Care credit card. As long as the balance is paid off in full within the specified period, interest-free benefits apply, alleviating the pressure of unexpected expenses. Many are also prioritizing health by adopting balanced diets, staying hydrated, and exercising regularly to reduce common illnesses and lower healthcare costs. However, it must be noted that these alternatives are merely stopgap measures and cannot replace the critical role of traditional health insurance in covering major illnesses and emergencies. Opting for these solutions still entails certain health risks. In truth, the collapse of the U.S. healthcare system is no secret. At its core, it operates as a profit-driven scam where commercial insurers reap the greatest benefits while patients and healthcare providers face severe exploitation. The system functions by having a minority of healthy individuals subsidize the entire framework using premiums from the healthy majority to cover medical costs for the sick minority, while insurers extract massive profits. Fitch Ratings projects that U.S. property and casualty insurers will maintain robust underwriting profits through 2026, with a combined ratio expected to range between 96% and 97%. Meanwhile, health insurers sustain high profitability by strictly controlling claims and raising premiums. To maximize profits, commercial insurers design policies with high deductibles and complex clauses to minimize payouts, shifting costs onto policyholders. In 2025, the average total cost of employer-sponsored health insurance for a family of 4 reached $26,993, with employees personally bearing approximately $6,850. This figure is projected to rise by another 9% in 2026. Yet, for a family of 4 without significant chronic conditions, the actual annual value of healthcare services required falls far below this amount. For instance, a bronze tier HMO plan carries a deductible as high as $9,000 and requires a monthly premium of $430. When insurance is actually needed, individuals must first pay over $9,000 out of pocket, rendering the coverage largely ineffective. Insurance companies arbitrarily cancel drug coverage, reverse primary and secondary coverage responsibilities, and delay claims processing to further squeeze payouts and maximize profits. United Healthcare's 32% claim denial rate stands as stark proof of this predatory practice. This system not only exploits patients but also squeezes healthcare providers. Insurers manipulate treatment costs, forcing doctors to accept low fees. Cumbersome paperwork forces physicians to spend excessive time on non-clinical tasks. Independent clinics must drastically cut prices to remain in insurance networks, plunging into vicious price wars that shrink their survival space. Doctors are forced to see more patients in less time, turning examination rooms into assembly lines. Patients typically receive only 5 minutes of consultation time, with doctors focused on computerized record-keeping, leaving no time to address patients' conditions and causing a significant decline in healthcare quality. Furthermore, the allocation of healthcare resources in the United States is highly inequitable. High-income groups enjoy premium medical services and comprehensive insurance coverage, while low-income groups face skyrocketing premiums, inadequate coverage, or even lack of insurance altogether. The original intent of the Affordable Care Act (ECA) was to expand healthcare coverage and make medical insurance more affordable for more people. However, due to partisan political gridlock, enhanced subsidies were not renewed, severely undermining the law's effectiveness and instead trapping more people in healthcare crises. The entire healthcare system is now caught in a vicious cycle. Insurance companies raise premiums and reduce payouts to maximize profits. Policyholders, burdened by rising costs, drop their coverage. As more people drop out, the insurance pool becomes less healthy, driving premiums even higher. The result is higher premiums mean worse coverage. The worse the coverage, the more people drop their plans. This fully exposes the system's structural flaws. Faced with such a severe healthcare crisis, an increasing number of Americans are awakening. Their demands are highly focused on universal healthcare, calling for fundamental reform of the existing system to treat healthcare as a basic human right rather than a commodity. People are gradually recognizing that the current, commercialized, healthcare model has strayed from its original purpose of providing medical security and fails to meet the basic health needs of ordinary people. Therefore, fundamental reform is imperative. Obamacare, lacking sustained government subsidies, is becoming unsustainable. After subsidies expire in 2026, over 20 million enrollees will face skyrocketing premiums, further highlighting the fragility and unsustainability of the existing system. The latest West Health Gallup poll reveals that 29% of respondents cite healthcare costs as America's most pressing healthcare challenge, the highest proportion since 2004, only 24% of Americans express positive views on the nation's healthcare system, marking a 20-year low. 23% believe the U.S. healthcare system is in crisis, while 47% perceive significant problems. In swing districts, 88% of voters support Medicaid, with 61% strongly backing it and only 10% opposing it. This clearly demonstrates the public's urgent need for public healthcare coverage. Public demands for healthcare reform are clear. Extend enhanced subsidies under Obamacare to prevent unreasonable premium hikes. Strengthen oversight of insurance companies, standardize claims processing, reduce denial rates, and protect policyholders' rights. Expand public insurance coverage to establish universal health care, ending medical commodification, and enhance drug price regulation to lower prescription costs, making essential medications affordable for ordinary citizens. Additionally, citizens call for greater transparency in healthcare pricing and standardized partnerships between medical institutions and insurers to prevent absurd situations where insurance reimbursement costs more than cash payments. However, partisan political maneuvering over healthcare policies has become the greatest obstacle to reform medical coverage to truly return to its core purpose, safeguarding public health. Gallup's survey further reveals that 47% of American adults fear they won't be able to afford necessary medical services. Next year, 30% of households have members who forego medical treatment due to high costs, while 20% skip purchasing prescription drugs. These figures clearly demonstrate that healthcare distress is widespread. Even in the best-performing states, 1/4 of residents abandon medically recommended treatments because of expenses. Viewers, by now you should understand the helplessness and anger felt by Americans. Healthcare is a fundamental human right. Everyone should have access to medical services. Yet in the United States, the world's wealthiest nation, ordinary people must fight tooth and nail for coverage, often sacrificing dignity and aspirations. The 2026 healthcare crisis isn't accidental, it's the culmination of long-standing systemic contradictions. Do you think the U.S. healthcare system can still be saved? If you were in their shoes, would you drop your insurance or tough it out? Share your thoughts in the comments below, and don't forget to like and share this video to help more people understand the reality of healthcare in America. If you found this video helpful, subscribe to my channel for more updates on U.S. living conditions and healthcare guides. See you next time.